Hello, dear learners. I welcome you all to this important module on English for Nursing and Healthcare, which is a part of the MOOC on Introduction to Functional English. From the previous modules, you must have understood the role of English for computers, the Internet, and the use of English in the field of information and communication technology. In this module, we shall try to discuss the role of the English language in the field of nursing and healthcare. Perhaps you know that being able to communicate is an essential skill for all healthcare professionals, and it is particularly important for nurses who are with people and their families for many hours a day. It is not always easy to understand what people are saying or to get them to understand what you are trying to tell them. Sometimes nurses who are qualified also have difficulties understanding people who have regional accents, and many patients use different words for feelings and everyday events. Nurses need to communicate so they can find out about the people in their care by taking a nursing history, give them information about their care, and teach them about managing their illness. This module shall help you to understand the skills of successful communication through English on the part of both the healthcare professionals as well as the patients if they require to interact in a hospital or in any other places. So let's move on to the objectives of this module. So the objectives of this module are to discuss the importance of English in the field of nursing and healthcare. Enlist the role of the nurses while interacting with the patients and providing care and support. Enable the common people, patients or attendants to freely interact with the nurses or any staff in a hospital through English. Help the learners to understand the importance of both oral and written communication in the field of nursing and healthcare. So dear learners, let's move on to the most important topic in our module, that is communication in nursing in healthcare sector. By now, we have already learned about the different types of communication, and the most commonly used communication, especially in healthcare, is formal communication, which includes oral and written communication. Oral communication plays an important role in the day-to-day activities of a nurse. Nurses play a pivotal role in the process of effective communication, whether they are exchanging information with physicians, reporting to other shift nurses, or educating patients and their families. Communicating is a continuous process when one works in the healthcare industry. Not only do nurses relay relevant information to patients and their families, they are also responsible for updating the physician about the condition of their patients on a regular basis. Nurse-to-nurse reporting occurs whenever there is a change in assigned duties at the end of a shift, or if a patient is transferring to a different level of care. This type of communication plays a fundamental role in the nursing process and can result in either high-quality effective care or ineffective care caused by lack of information given by the particular nurse. For instance, a busy emergency room where a patient comes in from a motor vehicle accident is in critical condition. It is the physician's duty to be the team leader and to designate what needs to be done to his or her individual team members in a confident and efficient manner. If a team leader orders a drug without clearly stating the dosage or route, the nurse will have to assume the quantity and method of delivery. Do you see a problem here? Perhaps the nurse is an intern, miscalculated the medicine and gives the patient an ineffective dose, which might be the reason a patient will receive wrong treatment. As far as the team is concerned, they believe it was the correct dose since nothing was verbalized. It is up to the physician to clearly state their orders, not only for everyone to follow, but also with proper instructions. This type of oral communication is also crucial for the nurse who is recording in order to have an accurate written documentation. So, dear learners, how do you introduce yourself if you are a hospital staff. So let us imagine that you have joined a hospital as a nurse and it is your first day. When it is your first day at work, or if you move from one department or ward to another, you must make sure that you can introduce yourself properly to your new colleagues. So here are some sample conversations. So basically, while introducing yourself, you can use these type of sentences to introduce, such as my name is, you can utter your name, or I am, or you can say after meeting the person, nice to meet you, I am your name, pleased to meet you, I am, let me introduce myself, I am your name again. So again, lastly, we can also say that introducing yourself is a very important part of being a nurse. So now let us look at some very basic introduction and sample conversations for yourself to introduce to the patient or to any fellow colleague.
Hello, I am Purna, a staff nurse here at Namecare University Hospital. May I know your name?
Hi, my name is Minu. How are you?
I am good. Thanks for asking. I'd like you to meet Jamuna. She is our nursing assistant.
Nice to meet you, Jamuna.
Nice to meet you too. If you need anything, just let me know.
Thank you, Jamuna. Could you please get some water for Minu?
Sure, I'll be back in a minute.
Hi, Richa. Have you met the ward change nurse?
No, we haven't met yet.
May I introduce you to Sister Tara?
Good morning. My name is Richa. How do you do?
I'm doing well. How about you?
I am great. It's a pleasure to meet you.
The pleasure is mine. So, dear learners, I think you have now understood the basic conversation that can happen between a nurse and a patient or their colleague. So, when you are to meet people for the first time, you have to use formal or informal words to address them. Typically, if you are meeting someone new from work, especially if they are someone older or more senior than you have to use formal words. If you are meeting new friends or colleagues at the same level, you are then using informal words because that will make you more confident and it will make you take some room in their lives. So, dear friends, now let us discuss the role of the nurses. So, what does a nurse do? The answer probably depends on the experiences that we have had in the past. Most people think a nurse is someone who gives an injection at the doctor's office or simply is someone who assists the doctor. Furthermore, images of nurses in the media also paint a different picture of who a nurse really is. However, a nurse has a number of roles that he or she performs, often at the same time depending on a patient's needs and not the ones we assume them to do. With all of the changes in healthcare over the last few decades, that role has expanded even more. Let's explore few of these roles. So the first role that a nurse serves is of a caregiver. As a caregiver, a nurse provides hands-on care to patients in a variety of settings. This includes physical needs, which can range from total care, doing everything for someone, to helping a patient with illness prevention. The nurse maintains a patient's dignity while providing knowledgeable, skilled care. In addition, nurses care holistically for a patient. This means that nurses also address psychosocial, developmental, cultural, and spiritual needs. The role of caregiver includes all of the tasks and skills that we associate with nursing care, but also includes the other elements that make up the whole person. The next point, dear learners, is of a decision maker. So another role of the nurse as a decision maker is to use critical thinking skills to make decisions, set goals, and promote outcomes for a patient. These critical thinking skills include assessing the patient, identifying the problem, planning and implementing interventions, and evaluating the outcomes. A nurse uses clinical judgment, mostly his or her ability to discern what is best for the patient, to determine the best course of action for the patient. The third point that we are coming to is the communicator. As a communicator, the nurse understands that effective communication techniques can help improve the healthcare environment. Barriers to effective communication can inhibit the healing process. The nurse has to communicate effectively with the patient and family members as well as other members of the healthcare team. In addition, the nurse is responsible for written communication or patient charting, which is a key component to continuity of care for the patients. So dear learners, the next point that we are going to discuss is manager of care. So the nurse works with other healthcare workers as the manager of care and ensures that the patient's care is cohesive. The nurse directs and coordinates care by both professionals and non-professionals to confirm that a patient's goals are being met. The nurse is also responsible for the moment a patient enters the hospital till the time they are discharged for their home and beyond. This may even include overseeing home care instructions. For nurses in the hospital setting, the nurse is responsible for prioritizing and managing the care of multiple patients at the same time, which adds another dimension to this process. The next point that we are going to discuss is patient advocate. Being a patient advocate may be the most important of all nursing roles. As a patient advocate, the nurse's responsibility is to protect a patient's rights. When a patient is sick, they are unable to act as they might when they are well. The nurse acts as the patient's behalf and supports their decisions, standing up for his or her best interest at all times. This can empower a patient while recognizing that a patient's values supersede the healthcare providers. Last but not the least is the role of a teacher. So as a teacher, nurses help patients learn about their health, medications, treatments, and procedures as well as deal with challenges they may face during and after their illness. Patients often have questions and might be confused about all that is happening to them. As a teacher, the nurse may also need to instruct family members about how they can help a patient. In addition, discharge instructions or instructions about what to do once they are not in a hospital setting. And these are also important so that a patient can easily care for themselves at home. So dear learners, as we see that there are various roles that are carried on by a nurse in order to facilitate their patients with the best care they deserve. So now let's move on to record keeping of patients, which is actually a very important role that a nurse has to do, as they are the record keepers and they need to document well when they serve a patient. So record keeping is the act of organizing and documenting information relevant to a patient's treatment. Good patient records include well-documented details about patient care and the patient's response to that care. Proper record keeping is very important. A patient record is a permanent documentation of a patient's care by a healthcare provider. While it might feel as if a nurse is interrupting treatment to write down notes, but patient records are vitally important to the continuing care of a patient. For instance, a nurse may encounter 20 different patients in a day. It is not possible to remember details about each of these patients and their details. Nurses must learn the principles of good record keeping because these records serve as a history of client care, reveal patterns in a patient's progress, guide further care decisions, support financial billing, and may even be used as evidence if legal issues arise. Here, English serves as a universal language of keeping these records as it is one of the most used languages for official use. So, a nurse who is fluent in spoken and written English will be able to keep records properly and clearly will have an advantage over the ones with no knowledge or minimum knowledge in English. So, dear learners, what do you think about written communication in healthcare? Well, written communication is permanent and legally bound in some fields such as nursing and healthcare. Written communication between all parties, including the doctors, nurses, patients, and patient families, can occur in a number of forms. The key to all written communication is that it should be clear and accurate. Using correct terminology ensures that other medical professionals can understand the condition of patients without errors. It also ensures that all those involved clearly understand the plan of care. The nurse's job is not to interrogate the physician but rather to confirm the orders in a professional manner so that the patient receives the appropriate quality care. In this case, accurate written communication is necessary for successful communication to occur. Effective communication is a very important concept for nurses and all those who are involved in healthcare. Quality care simply cannot exist without it. We talked about the two main forms of communication, verbal and non-verbal. Verbal communication is the use of words to deliver the intended message, and non-verbal communication is the use of wordless messages such as body language or facial expressions. Focusing on the verbal forms of communication, we further divided it into oral and written communication, so the messages will either be written or spoken. For nurses, the information they pass along to physicians, patients, and other nurses need to be clear and accurate. So, dear learners, when you enter a hospital, you are asked few questions to collect the data for you being the patient or anyone whom you are accompanying. So here is a list of questions that you might be asked to fill up in the forms that are available in the hospital, whether you are being the patient or being the attendant. So from this list, I hope you have come across some questions that are very frequent in the hospital interaction when you first enter the hospital. But let's talk about now about the therapeutic communication in healthcare. So for nurses, it is very important to give the therapeutic communication in healthcare. Because for people outside of the medical profession, a hospital or doctor's office can be a frightening place. The job of making a patient feel comforted and cared for often falls on the shoulders of the nurses. To best meet the needs of a patient, nurses must learn the principles of therapeutic communication, which is defined as communication strategies that support a patient's feeling of well-being. This term is easy to recall if you remember that something that is therapeutic is done to help a person cope with a situation and ultimately feel happier and more relaxed. The goals of therapeutic communication are to help a patient feel cared for and understood and establish a relationship in which the patient feels free to express any concern. A therapeutic nurse-patient relationship is a caring relationship that supports a patient's well-being. Key components needed to develop a therapeutic relationship include trust, respect, showing a genuine interest, and empathy. So dear learners, here are some sample conversations wherein we will look at some of the conversations between a patient, attendant and a nurse in a hospital where the patient has been admitted, and we will also see a conversation between a nurse and a doctor. Did you call me?
Yes, I did. I have body ache and mild fever since I woke up this morning.
Let me check. You have mild fever, but your blood pressure is normal. Nothing to worry about. The doctor will come on morning round between 9:30 and 10:30 a.m. Tell him about this when he is here. In the meantime, you can have your breakfast.
Okay. Are there more tests the patient needs to undergo? And when will the patient be discharged?
Like I said before, blood test on fasting state will be done tomorrow and the patient will be discharged most likely day after tomorrow. However, doctor will take the final call on the discharge date. So here is the next conversation between the doctor and nurse. Good morning, sir. I want to tell you of the patient's condition.
Okay, nurse. How is the condition? Is there any problem?
Yes, sir. She felt pain in her left abdomen. I want to ask about the medicine, sir. Is there any additional medicine for her, sir?
Oh, yes. I want you to give this additional medicine. It will help make her condition better. And don't forget to write down the receipt in the later report.
Okay, sir. I will do that. May I continue my work now, sir?
Oh, sure. Thank you for the nice discussion.
You're welcome, sir. So, by these two conversations, I hope you have come to know how a doctor and a nurse converse and how the nurse deals with the patient or the attendant who is attending the patient. So, now an important factor that is very vital to the nurses is to ask questions. For nurses, this is an important part because they have to identify patients' problems. In English, we basically have 4 types of questions that are commonly used in speaking. The first one being yes-no questions. Information questions is the second type of question. The third type is choice-based questions, and last but not the least are attached negative questions or tag questions. So the first one being yes-no questions, answers to such questions are simply a yes or no and they are known as short answers. Next, we have the information question. So a question that asks for information by using a word how, such as how many uses. For example, one use of how is to ask them about means, the ways. How painful is your chest? How to measure blood pressure. Next we can ask how often. So this may ask about the frequency, like how often do you wake during your sleep? How many times a week does your family visit you? Next we might go as how far, the most common way of expressing distance. How far is your house to the hospital? Last but not the least, how long or how many time. Ask for information about the length of time, such as how long will an operation be run. Next we have the different set of questions as who, whom and what. Who is used as the subject or question. Who comes, for example. Next we can use as who is used as the object in a question. Whom did you see? I saw someone. Next we can go to what, and that can be used as either subject and object. What happened with your stomach, for example, or what do you think about the nursing profession? Next we have what kind of asks for information about a specific type. So what kind of medicine did you receive? So that is an example of the specified information a nurse or a doctor might want. Next we have which is used when the speaker wants someone to make a choice when the speaker is offering alternatives. Which one of the legs is fractured? Where asks for a place. Where are you going? To see a doctor? When? Ask for time. When should Mr. Anil get a laboratory test? Whose? Ask for possession. Whose book is this? Or whose word is this? Next we have choice questions. A question that can be used first by using to be, is, are, am, were, was, and, do, does, did, has, have, etc. Is your pain in the left or right of your chest? For example, are you hungry or suffering? The last but not the least, the question set that have attached negative questions or tag questions. The statement sentences which a speaker is supposed to be or already known the answer, such as, you look very pale, don't you? You are feeling well after taking medicine, aren't you? So dear learners, I hope this will clear your doubts about any kind of questions that are asked or can be asked by a nurse to a patient or by a physician to any patient. So we come to the end of this module. From this module, we have learned that the use of English in the nursing profession is highly frequent. Moreover, the academicians also emphasize that the use of English is prominently frequent in nursing field, as they often use English in written materials during teaching nursing related subjects. Hence, we can say that English plays a very specific role in nursing and healthcare, and by learning the skills of communicating through the English language will surely help both caregivers like the nurses and the patients in communicating properly in a hospital-like setting. In the next module, we shall discuss yet another important module on English for doctors and patients. See you soon again, dear learners. Have a great day. Thank you.